Cardiff, Belfast, Edinburgh and now London, all the capitals of the United Kingdom now under tighter COVID restrictions. London, the latest to move to stricter rules which some towns and cities have been living under for months.
The virus is spreading rapidly in every corner of our city. The government will today announce that London will shortly be moving into Tier 2 or the high alert level of restrictions.
Although different systems operate across the UK and some places now have additional, tougher restrictions, by Saturday you won't be able to socialise at home indoors in the central belt of Scotland, in Northern Ireland, in the North East, the North West, parts of the North and of the Midlands, in the major conurbations of South Wales and in North Wales too, across all the boroughs of Greater London and Essex. It means that from Saturday, just under 35 million people will be unable to socialise in their own homes, 52% of the population. Across London, infection rates are doubling every 10 days. Ealing in West London has one of the worst spikes. Pubs and restaurants here now following cities elsewhere who've had to cope with restrictions on their customer base, with no access to the government help that comes when you're forced to close.
It will be really difficult to survive. It will be really difficult to predict what's going to happen. Now we kind of got to the point that we believe there is no other choice to unfortunately let some people go, and that's the only way to survive for a while.
No, I can't. I'm over it. Do you know what I mean? I'm going to wear my mask, be careful as I can, but I don't care what they're saying anymore. They're wrecking the country.
Yeah, I think it's going to be more or less the same. I don't think it's going to be that different.
Yeah. And that sort of teamwork.
In the Commons, some London MPs hit back at the increased controls across all 32 boroughs of the capital.
Surely we need to look again at the nature of this London-wide Tier 2 position, because there could even be regional areas that could be taken out. There are big disparities. Please think again. Otherwise, as one constituent has literally rung me today, he has said, is this in fact a London-wide Tier 2 to stop the north-south divide argument running?
In Manchester, the north-south debate was running hot. Local government leaders are refusing to sign off on the government's demand that they move to the most severe level of restrictions, Tier 3. The Mayor of Greater Manchester said the government was putting the North West into lockdown, with nothing like the compensations for affected businesses and workers that were handed out in the national lockdown.
At the end of the day, we can't simply be treated, in effect, as second-class citizens, where the government can impose an underfunded regional lockdown on us and all the damage that would entail. We have to protect the health of the nation, but let's do it as one nation and not make the north of England the sacrificial lamb for an ill-thought-through Downing Street policy which doesn't make sense in the real world.
The talks with the government are still deadlocked. A call this morning between the government and MPs from the North West did nothing to unblock them.
There was unanimous fury on that call about the process, about the evidence base and about the economic support packages on the table.
The meeting we had earlier today was entirely pointless and may as well have taught to a war, quite frankly, Mr. Speaker. When are we going to be properly consulted, learn about measures through the right channels rather than via the media? And can I put a question which I pose to the Prime Minister, to the Secretary of State now? The closure of hospitality will drive people into private dwellings where they will mix. We do not, thank goodness, live in a police state, for that would be the only way to police it. Can they please listen to common sense and think again?
Very sadly, across Lancashire and across Greater Manchester, the number of cases of coronavirus continues to rise. The number of cases amongst the over 60s continues to rise. The number of hospitalisations continues to rise. And further action is therefore necessary. And I very much hope that we can reach the sort of cross-party agreement that we have had in London.
It's quite a difficult thing to plan too, isn't it?
As much of the country began to retreat further inside, the Queen stepped out.
And now it's doubling itself again, isn't it?
She made her first outside public engagement since lockdown in March, to the Defence Laboratories at Porton Down to thank staff for their work on COVID-19. Carefully observed social distancing here, but not at this West London wedding, shut down by the police. who say the organiser could face a £10,000 fine. Enforcement of restrictions now expected to rise as compliance, second time round, wanes.
Gary Kibben, let's go to our North of England correspondent Claire Fallon for more reaction from Manchester. Claire.
Well, this evening, it is very clear that if Greater Manchester does join Merseyside in Tier 3 with the tightest restrictions, including the closure of pubs, then it will go there with leaders here kicking and screaming, and not by consent. And I think essentially Andy Burnham knows that the argument that he's making is actually fairly complicated. It can't really be summed up in 3 words and stuck to the front of the podium. So instead, I think what he tried to do was strap rocket boosters onto his argument, because he's not just saying that the Tier 3 restrictions don't have enough financial support alongside them. He's also saying that he doesn't believe that they will work. So it's the worst of both worlds. Very tight restrictions that will close some businesses, that will force people into a huge amount of hardship while not actually doing what they are meant to do. And he's also talking about the context, because Greater Manchester has had lockdown restrictions in place for 2.5 months that are actually pretty similar to the Tier 2 restrictions that London is just getting now. And so he's talking about people being frustrated, not seeing an end in sight, and therefore not being willing to go with this because they don't believe it will work. But it is a hard argument, because in just over a month, Greater Manchester's hospitals, we're hearing that they have 4 times as many patients with COVID-19 being treated. And so when Andy Burnham made his argument, very strong language, talking about this area being used as a canary down the coal mine for an experiment, saying being pushed aside, forgotten, and taken back to the brink of the 1980s. But actually, when he was talking, I think there was a resonance with something way further back than that, because bear in mind, he said those words here, St Peter's Square, Peterloo, just down there, which was sparked by protests by thousands of people who came to the city centre to protest against decisions being imposed on them from London, which were causing hardship. And I think that's no accident. I think he intended to conjure that up with what he was saying today.
Claire Fallon, well, we asked Downing Street for a government minister to appear on the programme. We were told no one was available. Labour's Shadow Work and Pensions Minister, Jonathan Reynolds, is the MP for Stalybridge and Hyde. That's a constituency in Greater Manchester, and he joins us now from Westminster. Let's get to the financial support in a moment, but can we begin with the measures in Tier 3 first? What's wrong with them, and what would you support instead?
Well, we've had enough, basically, and I think that clip showed that. People have got to understand that we've had in Greater Manchester 2 months of restrictions which are effectively like the Tier 2 restrictions that are now being banded as such. So in other words, we have had a really difficult time for our hospitality businesses, and we may have slowed the infection rate, but we are still heading to a very difficult position. So we know we need further measures, but the problem with the Tier 3 restrictions are that we're told by SAGE they're not enough, and at the same time, it's an offer, frankly, of significant destitution for an unspecified period of time. Now, how can we sign up to that? That's clearly not enough. What we would prefer is a circuit breaker, is a 2 to 3 week closure. It's more comprehensive, comes with appropriate levels of financial support akin to the lockdown measures that we had at the beginning of the lockdown. That would give us the time. If we combine that with changes to things like test and trace, that would give us a chance of getting on top of this pandemic in Greater Manchester and other parts of the north of England. And the government has to listen to that.
Right, so in terms of measures, you want a full lockdown. So no mixing, all businesses effectively shut, people working from home, but you want the furlough scheme brought back.
Yes, it's about measures and more support. So it's not about saying we want less measures. We know what we have had at the minute isn't working. But how can we sign up to a package which might not work according to the government's own scientific advice, but is for a period of time we can't tell our constituents how long it would last for? It would mean a huge amount of hardship for businesses that are closed because the furlough scheme is less generous. But also, in terms of who's eligible for that support, it's much, much narrower. So it's a really difficult position to be in.
But you also see that by delaying further measures, more people are mixing, the virus is spreading, more people are going to catch it, more people are going to be hospitalised, and more people will die. while this row goes on?
We know action is required, but if we sign up now to a package that combines that level of hardship with, frankly, health restrictions that will not be effective, that is the worst position of all to be in. You know, today the government started the day by briefing they were going to force this on Greater Manchester, that we weren't going to get a choice in it. And they haven't been able to do that, not because of one party or another party, but because of the unity that exists in Greater Manchester, that this is not an acceptable
but do you accept
package.
that under Tier 3 there would be less infection? It may not work to, as the Chief Medical Officer said, it may not actually bring R down to the point it needs to be, but it will reduce infection. Well, and that's what's being delayed.
There would be further restrictions, you're right to say that. But if people don't have faith in that package, if we can't communicate that this is a package that will work, you know, the package is only as good as the public's willingness to comply with it. And they can read the scientific advice, that's already in the public domain. If they don't believe it will work, they won't stick to it. And of course, if people are put in a position where they simply haven't got enough to get by on, well, how are they then going to be able to comply with those restrictions? If I hear another government minister try and tell me that this crisis has proved that universal credit works and the package of measures that the social security system has in it currently works, well, frankly, if that was the case, there wouldn't be this argument about financial support. We all know it doesn't work, and that is why the situation is so difficult. I agree with you, there's an urgency. I'm not in any way taking away from that. I know where we will be in a relatively short space of time in terms of Greater Manchester's ICU beds and what that will mean for the rest of the health service in the area if we don't get a solution. The government have to listen to this very reasonable case that's being made by local and national representatives.
Thank you very much for joining us.
Well, earlier I spoke to Sadiq Khan, the Mayor for London, and I started by asking him whether he believed that the government should impose a 2 to 3 week circuit breaker lockdown.
Well, I'm quite old-fashioned when it comes to these things. I look at the evidence, and I was shocked when I read the SAGE evidence a few days ago, where they said a number of weeks ago the most effective thing to slow down the spread of the virus was a short national circuit breaker. And having this huge inconvenience for 2 weeks, I think, is far better than months and months and months of restrictions, causing huge inconvenience and misery to individuals, families, but also to businesses too.
You're not alone in advocating a short national circuit breaker. Why do you think the government is so resistant?
It's for the government to explain why they're ignoring the advice from SAGE. Experts they appointed to sit on SAGE. I'd hope it's not for ideological reasons or because of dogma. They can't cherry pick when to follow the advice of SAGE, and I worry that their delay will lead to long-term consequences.
Do you have any way of knowing whether the people or indeed the businesses, perhaps even more importantly, in London are with you or not?
Oh, look, let me be clear. There are no good options. We mustn't pretend any of the options are good. Nobody, least of all me, wants to be in Tier 2 or even Tier 1. But the earlier we go in, the more effective our actions can be. And the reason why we're doing this is to slow the spread of the virus, to give the government even more time to sort out their test, trace, isolate system. My message to the government is don't waste this time we're giving you.
So how much consultation was there with you and indeed with Mayor Burnham in Manchester?
Well, in London, I've got to give credit to Matt Hancock in particular for working with us. I'm the first person to criticise the government, but Matt Hancock has been speaking, listening, engaging with leaders across London, including myself, to make sure we have the information we need to make the right call. But at the same time, I'm lobbying the Prime Minister and Chancellor for additional financial support. It's not in the gift of Matt Hancock to give support to businesses, councils, individuals and families. It is in the gift of the Prime Minister and the Chancellor, and it's really important they step up.
Sounds as if there are divisions up there.
Well, look, I think the government should be working together, not just within Cabinet, but also with mayors and leaders across the country. This isn't a war where we're at war with each other, so they should keep things from us or prevent things being divulged. This is where we work together to try and slow the spread of the virus down. But they, in the meantime, get a grip with test, trace, isolate. Us going into Tier 2 gives the government time. They need to use it.
Mr. Mayor, thank you very much indeed for joining us.
Let's go to our health editor, Victoria MacDonald. Is this 2 or 3 week circuit breaker going to happen?
You can hear all the way through that there is a growing desire, I think, for something to happen more than these Tier 1, 2 and 3. Now, we had been led to believe earlier in the week that maybe we'd missed the boat on the circuit breaker, but there is a feeling that it is still not too late, that you could actually bring it in next week. Now, the critical point about a circuit breaker is that you give advance notice, so businesses have time to prepare. You try and do it during school holidays so it doesn't impact too much on education. We've had briefings from senior scientists who are saying that the measures that are in, one of the phrases that actually we were given was frankly useless. The hospitalisations are going up, the beds are filling up, the infections are increasing. Something has to happen now, and it is maybe, they're saying, not too late to give this idea of a circuit breaker a go.
And if test and trace worked, could it be avoided?
Well, here is the problem. The test and trace figures are out today as usual. Now, there has been a slight improvement in the number of people being tested, a slight improvement in the turnaround time, but not the contact tracing. That is still below 40%. And the more infections there are in the community, the harder it is to do that contact tracing. And there are some who are now saying that this needed to happen, that we needed to have got the system in way better shape earlier, before these infections started going up, because you have got to protect the NHS. We're right back where we were in March. We've got to stop those beds filling up.
Victoria MacDonald. Well, Dr. Alison Pittard is the Dean of the Faculty of Intensive Care Medicine, and she joins us now from Leeds. As you see this row over precise measures, what are you thinking?
I just wish we could all do the job that we're paid to do and that we enjoy, and that is looking after patients who are critically ill, certainly in my profession of intensive care medicine. And we've all heard the stories of the hot spots, and particularly Liverpool, where critical care facilities are becoming overwhelmed. This wave is very different to the first wave in terms of how the NHS is responding, because the first time round we almost shut down the NHS so that we could cope with the COVID patients. We know about the unintended consequences of that, and so what we must do is make sure that all those people who need to access healthcare for other reasons than COVID can actually get that care. And so that is one of the reasons why critical cares are filling up, because we have patients with COVID and all the other patients as well. And it's just so frustrating when we've put so much work in, particularly over the last few months, to make sure that we have the capacity to look after patients. We're better at identifying COVID patients early. And the only way we can ensure that we can look after everybody is by reducing community spread. And that's why we really want people, and everyone, we all have a role to play in adhering to the government guidance.
And so do you want just the government guidance, or do you want the idea of this circuit breaker to go further? Because we've heard from the scientists saying even they don't think Tier 3 is enough.
I think it's the only thing I can say as an intensive care doctor is we want to see fewer patients coming into critical care with COVID, so that we can look after all those patients who either need cancer surgery or other surgery, who have other chronic health problems that need our care, so that we can look after them. And whether that is a lockdown, whether it's just following hands, face, space, it's not for me to say. That's for the scientists in SAGE and the modelers and for government. But we want the community transmission rates to fall so that we can just do our job.
What are your colleagues telling you about how full intensive care units are?
Well, again, it depends on where you are in the country. But for example, in the northwest, their intensive care units are either almost full, or they are full and they've had to spill over into areas that don't normally look after critical care. And again, last time, a lot of hospitals around the country spilled over into operating theatres because operations had been halted. Certainly the planned care had been halted. And we don't want to do that. And so they're spilling over into wards. And that isn't what we want to do, but we do have some more capacity than we did the first time round. But again, we prefer not to do that. The more that we have to spill over, the more that staff are spread thinly. And we know from the first wave that will have a negative impact on staff health and well-being. We really need to look after our staff.
Dr. Alison Pittard, thank you very much.